Yeah, welcome to my channel. The topic of discussion is etiology and clinical manifestations of malaria. Malaria is a term which is formed from two words, mal meaning bad and area meaning air. Initially, malaria was thought to have been contracted through breathing of air coming from swampy areas. But studies have shown that malaria, which is a life-threatening disease, is actually caused by a parasitic protozoa known as Plasmodium. Worldwide, you have 4 species that are known to cause malaria. These include Plasmodium falciparum, Plasmodium ovale, Plasmodium vivax, Plasmodium malariae. And then recently, Plasmodium knowlesi, which causes malaria in rhesus monkeys, but is known now to cause malaria in humans, but it's restricted to areas like Malaysia, Singapore, the Philippines, and of these 5 species of Plasmodium, Plasmodium falciparum is the most pathogenic, which means that it is the one that may even cause, or that will cause fatal outcome, because it attacks or infects all forms of red blood cells, young, old, immature, and mature red blood cells, while the others tend to select the type of red blood cells they infect. Having said that, malaria parasites, that is Plasmodium, is transmitted by the female Anopheles mosquito through a bite in the process of obtaining a blood meal. It requires blood for ovarian development. But unknown to it, the infective stage of the Plasmodium, known as the sporozoite, is present in the salivary gland, and so it is transmitted to humans during the bite of the female Anopheles mosquito. Briefly, the life cycle of Plasmodium species consists of 3 cycles, oscillating between 2 hosts, the human host or the vertebrate host, is in which the asexual multiplication of Plasmodium occurs. And these, the 2 cycles include the pre-erythrocytic cycle or exoerythrocytic cycle, and then the erythrocytic cycle. Then in the invertebrate host, you have the sporogonic cycle, which occurs in the female Anopheles mosquito. Here, the macrogametes form from the macrogametocyte, and the microgametes fuse to form what is called a zygote, and then it becomes a mobile or traveling vermicule or eukaryote. Eventually, oocysts form on the abdominal wall of the female Anopheles mosquito, and when it's fully matured, ruptures to release the sporozoites to find their way into the salivary gland. Now, having that at the back of our minds, let's look at clinical manifestations of malaria. Before the classical malaria or febrile paroxysm occurs, there are early signs of malaria or prodromal signs, which include headache, backache, malaise, dizziness, anorexia. Then the malaria paroxysm is a cyclical occurrence which involves three main stages. The patient experiences a cold stage in which sudden coldness comes upon him. He shivers with chattering of the teeth. He reaches out for blanket or whatever he can get to keep himself warm. This may last between 15 to 50 minutes. And this is now followed by the hot stage. The hallmark of this stage is fever, increase in body temperature, which is as high as 40 degrees Celsius, with accompanying headache, nausea, vomiting, abdominal pains, which may last between 2 to 4 hours. Then there is the sweating stage. Suddenly starts sweating, drenching sweats, and he throws off the blanket, and then he feels tired. The classical febrile paroxysm actually occurs at the end of the erythrocytic schizogonic cycle in infected red blood cells. The peak of the infection is due to the bursting of the infected red blood cells containing the matured skin zones. So neurozoids, end products of hematine, end product of hemoglobin digestion and other fragments are released into the blood. And the body responds, the immune system responds with mobilization of cytokines and increase in body temperature. There are two types of periodicity. You have the Tertian periodicity of the classical febrile paroxysm, which occurs every 48 hours or every third day. And this is common to Plasmodium vivax, Plasmodium ovale, Plasmodium falciparum. Then you have the quatern periodicity, in which the classical febrile paroxysm occurs every 72 hours or every fourth day. This is typical of Plasmodium malariae. It's also important to note that the tertian periodicity for Plasmodium falciparum may be irregular at first, the first few days. Then you have the quotidian periodicity, which is typical of Plasmodium knowlesi, occurring every day. That is the classical febrile paroxysm occurring every day. Let's look at the complications of Plasmodium falciparum malaria. One, you have the cerebral malaria. This occurs as a result of capillary sequestration of infected red blood cells, with the infected red blood cells adhering to the endothelium of the capillaries. With time, the oxygen supply to the cerebral tissue is reduced, leading to hypoxia. The patient is confused that this is in a state of delirium, and gradually he falls into a coma, and then death occurs. The second complication is black water fever, which is also known as hemoglobinuria. This is because of the extensive destruction of the red blood cells, leading to excretion of the hematine cast in the urine. The urine is dark brown or black in color. Then we also have algal malaria, where because of the resulting from the extensive destruction of the red blood cells, and then there is hypovolemia. There is hypovolemic shock. Then you have increased gastrointestinal symptoms, increased nausea, vomiting, abdominal cramps, then severe anemia because of the multiple infection of the Plasmodium falciparum in the infected red blood cells, resulting in extensive destruction of hemoglobin. Then you have the hepatosplenomegaly, which is the enlargement of the liver and the spleen. Thank you for listening.